Does overall health and medications affect PRP or other hair loss treatment results? Female, 43. Thinning, hairline recession. Biopsy above right temple could be consistent with early androgenetic alopecia. I am on medications, SSRI, Clonazepam, Valtrex, and some steroids for low BP. Have been for many years. Told I can't take Spiro because of low BP. Does herpes virus, low BP make me less likely to respond to treatment like PRP? Afraid to try Rogaine. Want to do PRP if I am good candidate. Advice on treatment and what treatments would work best?
Thank you for your question. You're 43 years old and you provide very good detail about your history. You state that you have hair thinning, you had a biopsy performed in the temporal area of your hair, which showed the area to be consistent with androgenetic alopecia. You further go on to describe that you are currently on an SSRI, Clonazepam, as well as a steroid for low blood pressure, in addition to Valtrex. You're asking, is the presence of herpes as well as the presence of low blood pressure in any way a negative influence on the benefits of platelet-rich plasma treatment of hair loss? You also mentioned that you can't take spironolactone because of your low blood pressure. Well, I can certainly assist you with these questions. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. Hair loss and hair thinning has been a big part of my practice for this time frame. In fact, I'm the founder of Tricostem Hair Regeneration Centers, where we offer a treatment combining platelet-rich plasma with extracellular matrix for the management of people who have both male and female pattern hair loss. So to get some perspective, especially in terms of the overall medical picture you present, and certainly your photos are very helpful and consistent with female pattern hair loss. When we manage patients, we often have comparable situations where there may be something that can affect healing, such as the use of steroids. There could be other medical chronic conditions. Essentially, when it comes down to it, I use a basic gauge and ask, when you get a cut, if you heal reasonably well and reasonably fast. Because there's so many diseases and conditions that do require the use of immunosuppressives, including steroids, that it is part of one's long-term picture that they can not be on these medications. So in our experience, what I've been able to do is, based on that simple question, effectively use a treatment that has PRP in it, but it's not PRP alone. Just to review, platelet-rich plasma, or PRP, is a concentration of the wound healing and growth factors that are necessary for when you get a cut. So there are factors that stimulate blood supply to develop collagen and basically repair an area. When we treat male or female pattern hair loss, we've developed a treatment called hair regeneration. What we're essentially doing is we're using platelet-rich plasma in combination with extracellular matrix, which we've developed over many years of development in treating patients who've come to us from all over the world, a system so that when we do this treatment, more than 99% of both men and women will stop having progressive hair loss, will have reactivation of thinning hair that isn't growing, as well as having thinning hair shed out and then thicker hairs grow in. Now, we follow our patients from on average up to 18 months, and we have data that goes well beyond 5 years showing the long-term benefit. We still treat everybody as an individual, and in some patients we'll actually do a second injection into the second year, not as a way to maintain, but as actually a way to strengthen the benefits of the first. In other words, we're able to actually take people with more advanced hair loss and get them a little bit more strength in the quality of their hair as well as thickness in the hairs that are extremely fine and almost imperceptible. So it results in better coverage. So with this process, we've been very successful, and as I said, we treat patients who come from all over the world. The point is that in your situation, you can still avail yourself to this potentially as an option for you. Unfortunately, the limitations of the management of female pattern hair loss is truly limited. You have only minoxidil, which of course is a concern because of your existing issue with low blood pressure, since minoxidil is still potentially can affect blood pressure, even though in rare it's unusual, but because it is topically applied and systemically absorbed, I understand your hesitancy not to use it, which leaves you with only the other option of transplant. And for most women, unless there's an area which really low density, your transplant does not make the same type of impact as it does for male pattern hair loss, where there's smooth skin with no hair. So understanding that hair regeneration is probably a viable option for you, look for resources where hair regeneration is offered and find and learn more so that you can maybe consider this as a way to manage your thinning hair. What's remarkable is that as we have been very successful with this treatment, people have come to us stating how frustrating it is for women to find an option for hair loss treatment. In fact, as more and more people are learning about this treatment, we're actually seeing younger and younger women who have biopsy-confirmed androgenetic alopecia. And this is women who are in their 30s as well as their 20s. So it's remarkable how as much as there is scientific knowledge and a lot of literature and articles written about hair loss, how little we can actually use to help people with hair loss. That's why hair regeneration has been so successful. So I hope that was helpful. I wish you the best of luck. Thank you for your question.